Well, thank you for joining us this year, 2021. This is our first D-Series talk, and we're so fortunate to have Rachel to join us. And and before we start with Rachel, I'm sure you got some of our email that we are opening our application for the 2021 Roseman Innovators. The application opened on January 26th at noon. And so if you know, or if you're interested, if your company or digital, health technology, medical devices, things that services, we welcome you to apply for the Roseman Innovators. So with that, I'd like to introduce you, Rachel Selden. So you can see her on the screen. Rachel is a partner at Oliver Wyman, and she has a lot of experience strategy consulting across all sectors of healthcare. She knows a lot about the payers, the provider, health tech, and the pharma. And she's also worked in a startup before, and then went back to Oliver Wyman, and now she's a partner for the Oliver Wyman Health and Life Sciences practices. Rachel came from two big universities here in the Bay Area. She got her bachelor from Stanford and PhD from Berkeley. So you covered both places. So that was great. And so I was talking to Rachel sometime last year, talking about how employer is such a critical stakeholder in the US healthcare system. And she has so much knowledge about how to work with them and what they're looking for. And I thought if she can share her insight with you guys, and that helps you identify what's the right path to get to that particular market, I thought that would be helpful. And that's Rachel say yes, and so here we are. And so with that, I'll let Rachel take this over. And so we're going to reserve our Q&A towards the 20-25 minutes at the end of this talk. So feel free to type in your Q&A as you have question, and then we'll go try to answer those questions towards the end of the talk. Okay, so with that, Rachel, thanks.
Thank you, Christine, and good afternoon, everyone. Thank you for joining us this afternoon. I am really excited to be sharing some of the perspectives on the employer market. And as Christine mentioned, employers are a major stakeholder in U.S. healthcare. They're one of the major buyers of healthcare services in the country, and they're also a pretty compelling path for newer companies to bring their solutions to market for a lot of reasons, and we'll get into those. But that's the employers generally have kind of shorter selling cycles and health plans. There's a lot more of them, so there are a lot of different value propositions that you can kind of go after. And I think we've seen a lot of companies that are now big and publicly traded and making headlines kind of get their start in the employer segment. So I know a lot of you are kind of starting your businesses and maybe looking at this market as a compelling way to start to grow your business, and wanted to share some of kind of the things to consider as you're building a business and how to win with employer customers. And so there are going to be three questions that we cover over the course of the next hour. And kind of we'll talk about them kind of interweave through the content. But first of all, what is it that employers want? What are they looking for from health benefit solutions? And how is this changing? How should you be thinking about positioning your products given a changing healthcare market landscape? How do you think about positioning yourselves with companies to kind of help address employers' needs? And how are those different depending on the different types of employers you're talking to? And then last but certainly not least, employers are just one piece of a pretty complex ecosystem, and employers are going to be talking to you. They're going to be talking to their benefits consultants or their brokers, their health plans. They're going to have relationships with providers in the market. And as a new vendor, it's going to be really important that you consider your role in that broader ecosystem. And so how can you start to think about developing those relationships, and what are some of the kind of lessons learned from others on how to do that gracefully? So that's the goal. But just to start with a couple of fast facts that kind of help put the employer market in perspective. So we mentioned at the top of the hour, employers are a massive part of the healthcare ecosystem in the U.S. Almost half of Americans are covered by employers, either directly through their employer or through their spouse or their parents' plan. Their employers spend about $1.4 trillion on healthcare in 2020. That's a little over a third of all healthcare expenditures in the US. And the healthcare market for employers is growing. It's about 5% a year over the next 10 years. And so this is a big market and it's a growing market. When we talk about employers, we often talk about two different segments. You've got them in the dark blue, the commercial fully insured segment, and then dark blue is the self-funded and the light blue is the fully insured. Just a quick thing for those newer to the space, self-funded are kind of large employers. They pay all of their own medical expenses kind of directly, and they partner with kind of the health insurers that you know and love, like an Aetna or a Blue Shield of California, to administer benefits for them. Fully insured customers purchase their health benefits directly from an insurer, and that insurer covers the risk. So you'll start to hear those terms a lot. I just wanted to make sure we called them out at the top. So a lot of what you'll hear from employers when you're in conversations with them, when you're talking to others and saying, what do employers want? Or even when you're just reading the news, is that healthcare costs are really expensive. And the thing that employers are thinking about with their health benefits is how do I control costs as much as possible? The data that we're showing here is kind of employer health spend trend relative to other things that employers are paying for. So kind of this salaries and sort of overall inflation on goods. And as you can see, barring 2016 and 2017, health benefit costs per employee have been increasing faster than inflation and faster than wage growth. And that's created a pretty big challenge for employers. And I think we've seen, even as recently as the pandemic, health benefits are one of the things that make it really hard to be an employer today. And this is why employers spend so much time and attention on making sure their benefit strategies are sustainable over the long term. There are a lot of different drivers of why health benefits have gotten more expensive. There's underlying kind of price growth. There's, we have a population that's sicker than it used to be, and so people are consuming more services. And we also have, a market that's constructed in such a way that, rates can increase faster than kind of inflation and sort of the underlying market growth. One of the things, and we'd be remiss to not call this out more specifically with this audience, but another kind of big driver of health benefit spend is pharmaceuticals. And pharmacy services costs have increased at around 6% over the last couple of years, and that's projected to continue through 2030. So increasing faster than the rest of the market. And so I know a number of you on the line are thinking about developing new pharmaceuticals, and this is going to be an area where there's going to be increased attention from a cost perspective because it is a growing part of the pie. And not only is it a growing part of the pie, but there aren't that many ways to manage it well in current course and speed. So if you're looking for a good investment thesis or a good kind of market to get into, figuring out a better way to manage pharmacy costs is going to be an important thing that employers are going to be looking at, in addition to a lot of the health services that we're going to spend more of our time talking about today. So if employers have been kind of constantly fighting the battle of increasing healthcare costs so that they can continue to provide benefits to their employees, what is the tool that they've been using primarily to drive those costs down? And the data on this are pretty clear. What we've seen over the last 10 years is a pretty dramatic shift in the amount of spend that's shifted from employers to their employees. And the way that manifests is in deductibles. So I think probably most folks on the line have heard about a high deductible health plan. The statistics would guess that at least a third of us collectively, myself included, are on a high deductible health plan. But what this means is that consumers are on the hook for more of the spend up front. So employers are being asked to spend up at least $1,400 of their own money before their health benefits kick in. And so what this means for the employer one, yes, they have managed to reduce their healthcare costs by asking their employees to shoulder more of the burden, but they're also having to think about their health benefits in a different way, because now they're not just thinking about their health benefits from the perspective of an employer, of someone who's paying for the entire suite of services that an individual might consume, but they're also having to think about how an employee spends their money on healthcare and how they can kind of go after the consumer wallet effectively and do so in a way that promotes better health outcomes overall. And as you start thinking about this, you look at the spend from the healthcare system as a whole. So if you looked at the bar on the left-hand side, this is how an employer would normally think about healthcare spend. And then you look at the kind of bar on the right, which is the consumer out-of-pocket spend, and you notice there's some pretty dramatic differences in how an employer and a consumer are thinking about healthcare. And so now an employer is having to live in these two worlds. In their traditional role, an employer is thinking, how is it that I can kind of get the most value out of my hospital services? How is it that I can avoid inpatient stays or going to the emergency room or expensive surgeries that may or may not provide good outcomes? How is it that I can get my employees to go to the right doctor at the right time? So making the best use of kind of referrals to cardiology, orthopedics, or other such things. And they're spending, a lot of money on drugs. We talked about that, but not nearly as much as some of the more kind of expensive, but lower frequency things. And consumer, on the other hand, they're really thinking about how is it that I'm going to afford my prescription medications and where am I going to get them from? They're probably spending, a lot of their money on their primary care visits or going to urgent care, particularly if they're in a high deductible health plan. In fact, a lot of people in a high deductible plan will never even trigger their insurance. And so they're paying for all of their healthcare costs out of pocket. So the equation looks really different from a consumer's perspective, and employers have had to shift their mentality accordingly. So we're going to take a little detour, and we're going to think from the consumer's perspective for just a second. So we've been showing slides like this for my entire career, and I think this is something that's certainly evolving, and I think the last year has actually created a huge accelerant for how consumers are expecting to experience healthcare and then how they're actually consuming. But I think this, as you look at this slide and the continuum of what a healthcare experience a consumer kind of is going to be attracted to looks like, I think this all feels pretty intuitive. It's how we experience retail, consumer banking, pretty much every other industry that we interact with today. We want it to be kind of contextual in the flow of our life. We want to have services when and where we want them. We want the services to know who we are. Like, I shouldn't be having to answer in my name and my birthday and my date of birth and my address every single time I interact with a healthcare institution. I want to be able to share information across the various stakeholders that I'm interacting with, both in healthcare and not. As a consumer, I increasingly want my virtual and my kind of in-person experiences to feel consistent and feel the same, kind of moving across modalities seamlessly, just as I do when I'm going to an ATM versus depositing a check via my app. And we've, consumers have had these expectations for a while of healthcare, and there have been a lot of solutions out in the market that have really addressed them, though uptake has been low up until really recently. And what's one of the potential silver linings of the COVID-19 pandemic is it's exposed a lot more individuals to the fact that virtual health exists, and that we can actually have some of that on-demand access, that we can have that seamless kind of experience between the care that we're receiving kind of through our iPhone or our Android and the care that we're receiving in a doctor's office. And I think what we've seen over the last year is more and more people trying virtual health, and more people indicating that they'll stick with it over the long term. So these are a couple of numbers that kind of all speak to the same trend, that consumers are more and more likely to kind of embrace new technologies, embrace new ways of receiving care, and they're increasingly comfortable with trying something new. It's just as good news for those of us on the phone today, because we are the ones bringing the innovations to the fore. And so there's a lot of receptivity, and I think employers are seeing, I'm not suspending my virtual health dollars, providing access to a virtual health solution because I think it's something that I need to do to keep up with the Joneses, but because it's actually going to be a critical part of the health benefit suite going forward. One kind of point of caveat, and we'll say this a couple of times, but a consumer is not a consumer, just like an employer is not an employer. And so there are a couple of different ways employers are thinking about how consumers are interacting with virtual health and what they need to do as employers to get them comfortable. And what you see here is we did a survey with our sister company Mercer across the world, and you find that consumers roughly fall into 4 different segments when it comes to virtual health and new health innovations more broadly, with 37% of people saying, they're ready to go, sign me up. Generally are millennials and Generation Z. You've got the impress me. They're willing, but they are expecting to be courted. They are high-tech users, and they're willing to experiment with a lot of different things. So we really need to gain their loyalty. There's the get me comfortables. They've bought into the concept, and a lot of these people will have used virtual health for the first time over the course of the last year. And it's actually only a very small percentage, around 5%, that say virtual health is just not for them entirely. So it's a pretty big consumer market that's looking at kind of new ways of getting care. And so what all this boils down to, and Noah started the top of this talk talking about healthcare costs and how employers are kind of laser focused on reducing their costs. But that's insufficient. If they're taking the mindset of their employees and they're thinking about how do I kind of increase engagement, get the best use out of the consumer dollar and my dollar as an employer, you lead to a different set of priorities. And this is from a survey that Mercer launched of a number of different employers asking about what their priorities were for 2021. And I think the results are pretty striking. You don't see cost anywhere on this list. Behavioral health certainly is a big one, particularly given the stresses of the pandemic, of the recession, of social unrest. There's just been a ton in the last year, and people are feeling strained. You have things like diabetes, weight management that you might expect, but also financial well-being, understanding that as individuals are having to pay for more of their healthcare, the employer, it's part of their responsibility as they shift more of these costs down to the employee, that they help the employee actually manage that budget and make sure that they get the healthcare that they need. And I think also somewhat surprisingly, because there's, call it middle of last year, there was a lot of kind of suspicion that employers would kind of set it and regret it. They'd take their, set it and move on, right? They would take their benefits that they had from the prior year. They weren't going to invest in any new solutions. They were just going to hunker down and try and get through 2020 as best they can. And what we've actually seen is a number of employers adopt new strategies and adopt new solutions. So certainly in telehealth, given the explosion of virtual care over the last year, but also voluntary benefits, increasing behavioral health access, and increasing the number of point solutions, largely virtually enabled ones, to help people manage their care when they can't go to the doctor and they can't interact with providers in person all the time. And so just to quickly summarize, because we just talked about a lot of things that employers and employees want. So we said for employers is, first they want to be able to manage their costs. They want to manage them in year, and they want to manage them over the long term, because healthcare is expensive and only getting more so. They want to be able to think about their populations as a whole, and they want to be able to kind of do so in a way that's tailored to their benefit strategies, and more on that in just a second. And employees are looking for better access. They're looking for transparent, predictable costs as they kind of take on more and more of the responsibility, and they're looking to access care in more ways, and in ways that kind of fit in with the rest of their lives. We just talked a lot about what employers want. But employers are not one size fits all. And I think as we transition to more of how an emerging company can position for themselves for success, understanding that there are different types of employers out there and that they buy different things is one of the critical first steps in developing a successful employer health benefits solution. And so spend a little bit of time on this page. But as you're thinking about the employer market and how employers buy, I have 2 axes that you should be thinking about. One is, what's the core benefits philosophy that the employer is optimizing for? And the other is, what's the core health and wellness philosophy? How is it that they view kind of beyond just the kind of costs and making sure people have access to healthcare? What's kind of their view on the added benefits that providing healthcare to employees brings? So you'll see employers who say, I just want to get the lowest possible costs this year as possible. My budget is set on an annual basis, and so I am trying to get the most out of my dollars in 2021, and then I'll take another fresh look in 2022, and so on and so forth. You have employers who say, I'm going to keep the costs within budget, and anything that I can no longer cover is going to get shifted onto my employees. And so they're kind of looking at sort of moving more and more of the responsibility onto individuals versus their own books. On the flip side, you see employers for whom offering traditional benefits is really important to who they are. And this is either because they've very much value taking care of their employees. You also see a lot of this in kind of unionized workforces where a lot of benefits are collectively bargained. But this is where they actually are doing as much as possible to not shift costs onto their employees, and they see it as kind of a mandate to provide comprehensive benefits. And then you have others who are saying, yes, I want to minimize my cost in year as much as possible, but I'm actually taking the longer view. I'm looking 5 years out, and I'm saying, I'm thinking, how am I going to invest in my employees' healthcare today to make sure I spend less in the future? And this is particularly true of employers who think they're going to hold on to their employees for quite a long time, so that investment pays off over the long term. And then as we go across the top, we have the core health and wellness philosophy. We talked about the cost containment. When it comes to health and wellness benefits, these are employers who are saying, I'm only going to invest in something if it pays me back money this year. You have employers who say, I think that most of the healthcare services that my employee is going to provide is going to come from their doctor or from their other providers. And so I'm only going to provide the basic tools to help them get there. For employers that are doing a lot of cost shifting to the employee, they often will want to provide some really sophisticated tooling so that employees can make good decisions with the money that they've been allocated for their healthcare. And then as you get towards the right, you have employers who take a much more activist stance, either very aggressively managing the health of their population, everything from having plans that are more tailored to designing their own networks, designing their own provider ecosystems, and actually taking control of the health system into their own hands. And you also have employers who say, benefits is a differentiator for me. It's part of my employee value proposition. And what I'm just going to try and make the experience as rich as possible and throw as many benefits at employees as I possibly can. And as we think about each of these two axes and the different things that employers can be optimizing for, you see some natural combinations of how people think about benefits and how people think about health and wellness. And that's kind of the lit up cells that you see in this chart. And as we go into a little bit more detail, these are the kind of 5 employer segments that you can keep in mind. And sort of as you're thinking about, 1, what's the type of employer I think is going to be attracted to my solution? And then 2, as you get out into the market and start talking to potential customers, be looking for cues and try and see what type of employer what type of segment they fit into, because it'll give you a good sense about whether or not your solution's a good fit. But starting at the left, price is king. These are employers that are looking to minimize in-year costs. For them, benefits is it's a burden, not a calling. It's something that they have to provide to their employees. And they will lower costs by any means necessary. They'll often be working with kind of a lower cost network. They'll be working with a TPA. Customer service is not going to be something that they value as much. And to the extent that they're deploying kind of value-added solutions, it's because those offer a lower cost product versus what they're getting from the traditional system. You'll see when you look at their plan designs, they have very narrow benefits and kind of bare bones coverage, just the minimum to pass muster. The next segment, I'll have what she's having. These are kind of your, they're your traditional kind of followers. They're not going to take the leading position and drive innovation. They're all about minimizing disruption for their employees and making sure that their benefits are competitive, but not kind of leading in the market. They're, the way they design their benefit packages are very benchmark driven. They'll take a look around kind of all the other employers in their sector and in their geography and say, okay, if they're all offering a diabetes management solution, I need to offer a diabetes management solution too. They'll generally have, moderately rich benefits. They'll generally have a broad network plan, and they'll ask for a lot of, what are the other employers like me that have this solution, and what have their outcomes been as you're talking to them. This next segment is teach a man to fish. And so these are employers that are looking to use benefits to train their employees to use the system better. And so for these, you'll see a lot of emphasis on consumer-directed health plans. We'll see high employee cost sharing. You'll see tools like, legacy Castlight. You'll see things like reference-based benefits, which is when there's a benefit level that's been set for a particular service, and it's on the consumer to shop and find a provider that comes in under that price. So you'll see a lot of that type of benefit, and you'll be ask questions about how do you help the consumer understand the cost? How do you help the consumer use their healthcare dollar wisely? We'll take care of you. So this is a lot of, as we mentioned, workplaces with a lot of union membership. Auto manufacturer would be a good example of this. For example, they generally have rich benefits, not a lot of cost sharing. They've been able to hold on to the copay only, low deductible plan designs. They'll have some investment in wellness strategies. They'll be more likely, though, to look at the underlying network and use that as a lever versus making the employee navigate the system themselves. And then the last segment, make the system work for us. This is where you're going to see a lot of your innovative employers, and we'll talk about this in a little bit later, but don't be fooled and think that all employers are like the ones in this segment. These are employers that are at the leading edge. These are your big tech firms. They very much value experimenting, innovating. Their organizations have a culture of innovation as a whole, and they bring that to their benefits plans as well. You'll often see custom networks. You'll see ACOs. They'll have adopted a near-site clinic, and it's not any near-site clinic, but they've actually shaped a lot of the offering themselves. And they're very willing to experiment and try new approaches, and they're a great first customer for a new solution in the market. So very important, as kind of alluded to on the last page, employers do not purchase benefit programs for the same reasons. And it's important to know what employers you're going after. It's important to know which of their consumers your solution is going to attract. Are you going to attract the individual who is the first in line for every new gadget, or are you going to be the solution that helps bring people into the virtual healthcare world that have been a little bit hesitant to try? But kind of being very crystal clear on who your kind of consumers that you're targeting and who the employers you're targeting is, obviously really important, and something that, in designing a new business, you all would do regardless. What I did want to talk about as well is some of the other players in the ecosystem that employers are relying on, and that, for your businesses, if you're going after the employer market, it's going to be really important for you to kind of plan your relationship out with these stakeholders in advance and be quite intentional in the way that you pursue it. So we'll start with brokers and consultants. Brokers and consultants, for those that are not as familiar with the space, work with employers to help employers purchase their benefits. Brokers do so on a kind of basically a percent of sales, so they're commission-based. Benefits consultants are more of a flat fee. But they are often, for the vast majority of employers, the first port of call when an employer says, I want to add, a new solution that helps provide access to cardiology support. They will go to their broker or their consultant, say, help me find the best vendor for me. You'll have some employers, again, on that more innovative end of the spectrum and on the very, very large end of the spectrum that don't use consultants quite as much, but they're probably more the anomaly than the general mode. And I think as you're thinking about, brokers and consultants, it's, how much of our go-to-market strategy is going to be reliant on these channels? What are the types of relationships that we need to develop now? How do we get their attention? Because as you can imagine, if these are the folks that are the kind of front door to the employer market, they're getting a lot of inbounds from different solutions and different startup companies all the time. How do we make ourselves stand out? To what extent do we try to go direct? And if we're doing so, how do we minimize any potential backlash on the channel and make sure that we preserve those relationships? And I think the other question is there a strategic partnership that we could strike with one of these consultants? That's been pretty successful for a lot of innovators that have been able to forge a relationship with a Willis Towers Watson or a Mercer or an Aon and say, give us we will give you preferential pricing in exchange for being kind of put in front of your customers. So definitely something to consider. The next stakeholder on this list is the health plans and the pharmacy benefit managers, depending on kind of just where your space sits. And as we mentioned kind of at the top of the talk, employers are either looking to their health plans as an administrator of the benefit, so they're designing the benefit, they're designing what solutions lie on top of it, or they're purchasing the vast majority of their healthcare services from the health plan through an insured product. As you're thinking about the health plans, one of the questions is, how deeply integrated does our product need to be in order to, with the health plan and the rest of the benefit, in order to deliver against the consumer experience and the employer experiencing that we're promising in the market? The integrations with health plans can be pretty expensive, both from a time and a resourcing perspective. And integrating with one health plan means you've integrated with one. There's not that much consistency across the board. And so, you'll need to be pretty judicious in how deep you go and with whom. One of the other questions you need to ask is, will health plans actually be a critical distribution partner for us? If you have a solution that's targeting that, like, I only innovate when the rest of the market has, and they're much more likely to buy a solution from their health plan versus go direct to a vendor. And so, having those deep health plan partner relationships is going to be critical. And if that's the case, you want to be forming those relationships early on versus waiting until you're at scale. And then this last question is, a lot of health plans are getting into, more than just providing benefits, and they are developing solutions that are competitive with a lot of innovators out in the market today. I think United is certainly a good example of that with their kind of level 2 solution in diabetes, and Anthem's got their kind of Castlight white labeled product. But a lot of different payers will see providing really good services to employers as part of their differentiator and how they compete with their peers. And so understanding how you fit in with the rest of the health plans offering and how competitive your solution is with theirs is important to navigating those relationships. And the last stakeholder to consider are providers. So particularly if you're offering a solution that's kind of providing care virtually or providing guidance, how is it that you kind of bridge the gap between where your solution ends and where the provider solution begins? And what are the relationships that you need kind of writ large and then within a specific community to support a specific employer in order to deliver that? Employers increasingly will expect that all of their health benefit solutions will kind of talk to each other and interact with each other. And that's not just limited to things that are purchased through the health plans or sit on top of the benefit, but more and more they're wanting their individual solution providers to work together and to work with providers that are traditionally in the network to deliver solutions. So, and with that, we'll close with 5 kind of tips and tricks for starting a employer business, and a couple of things to keep in mind. So the first one is making sure that you design for your end state target employer customer. So as we thought about those 5 segments that we went over in the beginning, who is the customer that you think is going to buy your service the most, and why? And it's important to note as you're thinking about your end state customer, that's not necessarily the first employer that's going to purchase your product, because you're likely going to get the early adopters who latch on first. And just being cognizant that not all of those employers that you're serving in the very early days of your business are necessarily going to be what the majority of your customers look like in 2 to 3 years. It's important to think about the long term on your go-to-market strategy now. We talked about how important relationships with brokers, consultants, health plans, and providers can be. Healthcare is a pretty small space, and so developing those relationships early and being really cognizant of basically not alienating anyone who's going to be critical to your success in the early days is going to be really important. And you've got the ellipses there because I wanted to really underscore, do not underestimate the importance of the channel partners. I think a lot of people very intuitively see, health plans are going to be really important. They're a distribution arm. They're how things get paid. They're the biggest vendor that a health benefits buyer is interacting with. But the channel partner is also really important. And a good relationship with brokers and consultants can make or break an employer business. Investing in forming partnerships and kind of recognizing that healthcare is a complex multi-stakeholder offering. Even the most integrated players like a KP or a United Healthcare don't own every part of the healthcare stack. Everyone's kind of working on partnerships and kind of developing relationships to kind of make sure that their employer customers and their consumers are navigating the system in an ideal way. And so thinking about which of those relationships are going to be important to your solution early on, and then going out and investing in them early will be very important. And then last and certainly not least, stay laser focused on the healthcare problem you're trying to solve, particularly in those early years when you're working with your first set of customers. There are going to be customers who want you to do all sorts of things that are adjacent to your core product, to your core value proposition. And it's going to be very tempting to say, yes, we will do that to keep them happy and to keep that business. But all of those things take resources. And so just stay really focused on the offering that you have, even if you have to say no to some customer opportunities in the near term, to stay true to that vision. And that is the end of the lecture portion of this conversation. We can move to Q&A.
Sounds great. Well, thank you, Rachel. Hold on one second. We have a few questions, and we can start sharing the screen so that people.
Yes.
Oh, I think Herminio has to stop the screen share for me. Oh, there you go. Okay, let's. We have a few questions. Let's start with the first one. It's a question from Neil. How do employers think about pregnancy care? I've heard that 50% of insurance premiums are allocated toward perinatal services. Where are the opportunities to innovate in this space from the employer perspective?
Yeah. So it's certainly a very intense area of focus, and I think a lot of people saw, and I'm blanking on which, Big Val, I think it might have been Yahoo, kind of talked about, there was a $2 million claim, and he mentioned it in an earnings report, which was not ideal. But I think pregnancy is certainly a high cost area. It's not the most predictable of spend, and particularly as people are having kids later and later in life, the spend associated with pregnancy is increasing. So it's certainly something that they think about and have invested in developing solutions, in kind of buying solutions around that. So, Avia is an example of a vendor that's out there, but there are a number of others that are around kind of the maternal experience. You have, Carrot Fertility and Progeny and a number of different fertility solutions, everything from kind of advice in an app to an actual kind of network of fertility centers that employers can contract with on top of their normal benefits, so that they make sure that their employees are getting the best fertility care that's kind of minimized to get people pregnant fast and lower costs long term. So it's certainly something that employers are thinking about a lot. I think there's, obviously there's continues to be room to innovate in the space, and this is one where creating closer connectivity with the in-person care delivery system is going to be important, because when you're pregnant and having a baby, you've got to go in. It's not something that can be done entirely virtually. So I think there's definitely room for new innovations that kind of bridge the gap and create a more cohesive virtual experience that then ties in to physical care delivery.
That's great. Next question comes from Kimberly. Can you tell us more about the enterprise market for mental health services?
Yeah, so this has exploded. And it's one of these things where I was joking with another friend, like it's moved so fast that like I actually can't keep up anymore. I think, we saw a quarter of large employers have added a new mental health solution this year, just because there's so much need and there's so little access, and we are grossly undersupplied in this country when it comes to mental health resources. And that's before we even consider whether or not those mental health resources are in network. So there's tremendous appetite for good solutions here. I think there's a lot of competition. There's a lot of competition that is driving towards lower price points too. And so this is going to be an area where being able to provide not just high quality care, but high quality care that is, often automated is going to be important in the next couple of years, because you've already got solutions where a lot of the mental health services are delivered by AI, and it's going to dramatically increase access, but it's going to bring down the price point for mental health care, and that's going to be something important to consider.
How does the employer, I mean, you mentioned that there's very competitive. There's a lot of people who are, jumping into this solution. How does the employer, kind of get rid of the noise and pick the right one for them?
This is where the brokers and the benefits consultants come into play, and why they're so important. And I saw there was a question about, how much does the mid-market, like 1,000 to 5,000 employees, use their consultants, and that they are using their consultants a lot at that stage. And most employers, below that are, almost exclusively relying on their consultants to provide recommendations. So, employers will kind of say what they're optimizing for. Am I optimizing for kind of cheap access? Do I want to have kind of a very high touch experience? Do I want something that's been tried and true and in the market for a while, or am I willing to try something new? And then, the benefits consultants will say, here's, 5 vendors that we recommend you look at, and then they'll do an RFI. So kind of being on the list and getting attention of the consultants, particularly as you're going down market, is really important.
And who are the top brokers and consultants?
Depends on your market. So, across the country, Mercer and Willis Towers Watson are the big ones. There's, groups like Gallagher, Lockton, Alliant. In the Bay Area, Sequoia is pretty big. Woodruff Sawyer is pretty big. You go from kind of the big three, which is where the majority of very large employers will purchase their benefits consulting from. And then as you get into kind of the smaller end of the market, so think, anything from 1 to 2 employees all the way up to, call it 1,000, it's a pretty fragmented space. And it just depends on what geographies you're selling into, which relationships you need.
Mm-hmm. Okay. Next question. How do you deal with compensation with all these different partners? And what is the business model?
So this depends. It depends entirely. If you are using a channel partner, like a broker or a consultant or a health plan as a distribution partner, they'll often get paid commission. And that can be really expensive. So you need to think about that early on. And it can follow you for a long time if you strike those relationships poorly. Some of the other relationships, so thinking about a health plan relationship, that can look more like co-marketing. And so there isn't actually money changing hands, but there's the concept that if we bring a lead to you, we both benefit. And so that can be a little bit less expensive, but also not yield nearly as much in the way of return, because you're not incentivizing them monetarily to produce leads for you.
Okay. Dental question.
Yes.
Dental care is typically thought of as secondary to medical care, and the two have historically been siloed. Any thoughts on how employers think of dental care, or any trends you can speak of?
Yeah, and you'll meet the employer from time to time who recognizes how important dental is, and it's in that cost stack that I showed earlier. You see that people are spending as much, if not more, money on the dentist than they are going to the doctor, and people trade off, like, which am I going to go to this year? Employers are not quite there yet. I think a lot of employers see dental as something they have to buy, and it's not something they spend a lot of time thinking about designing, and it is an afterthought. You'll see, some of the carriers, or actually all of the carriers, have dental offerings, and they will talk a big game about how medical and dental integration is really important to employee health. I think the actual integration that happens behind the scenes remains to be seen how extensive that is, and therefore how much it's paying off. Mm-hmm. But it's certainly, it's an important area, and I think as there's certainly room to increase kind of awareness of how important dental is. It just doesn't cost as much as the core medical benefit, and so it doesn't get the attention that the rest of the stack does.
Okay, well, that's good. It doesn't cost that much. Next question. Well, we have Glenn Tillman is giving a talk next week, actually. So one of the questions come from somebody who wants if you are familiar, like, can you walk us through a success story like Livongo? What did they do right and better than their competitors? And was it a strong focus on channels? I mean, like how?
Yeah, and we can take the Livongo example because they are such a success story, and then you should ask the same question to Glenn because you will probably get a different answer.
Yeah,
but
that's why I thought of you asking.
but you know what Livongo did really well, a couple things. They were laser focused on their mission, which was removing barriers for individuals living with chronic conditions and specifically diabetes to start. And they did not compromise on a lot of things when it came to the product. So they were asked, can you brand this under like the name of the employer? Can you brand this under the name of the health plan they're working with? Can you work with coaches that are not your own? And they were pretty, they were pretty consistent in saying, this is what the product needs to look like because this is how we deliver the results that you all expect. Livongo also had very strong relationships with a number of the different channel partners. So they were not they were able to go direct to an employer and kind of talk about how, the Livongo value proposition is, really compelling and why every employer should purchase. But they also had those strong channel relationships. So, you weren't going to a customer and having the Aon consultant find out about it after the fact. And that's really important because the consultants were big advocates of Livongo versus saying, hey, you don't want to work with those people because I don't want to work with those people. I think one of the other things that they did really well that we didn't talk about as much is investing in proving out the outcomes of their solutions. So, a lot of the initial Livongo value proposition was around reducing barriers to getting access to treatment, making test strips more affordable, increasing kind of compliance with that type of with that aspect of the treatment and driving behavioral change, with the kind of promise that if you believe all of those things lower costs, Livongo will also lower costs. And I think what they did really nicely is then follow through and say, let's actually measure the success of all the different interventions that we're having so that we can start to translate kind of the soft dollar, like if you believe, savings from the early pitch to now kind of increasingly being able to go to an employer and say, yes, you actually will get cost savings and we're willing to put some of our money at risk in order to guarantee those.
Do you think that will be the trend though? Because everybody probably always want to see the result and measurement. And do you think when Livongo did it, that was not the norm?
I think I think it was untrodden territory. So a lot of the, at the time Livongo was competing against kind of more traditional disease management programs that were often kind of through a payer. They were not really that targeted to diabetes specifically. And so the outcomes, people just didn't measure them that much. I think it is certainly the expectation now, particularly given how much, a solution like Livongo costs for an employer. It's a lot more than what an employer is used to paying for something that looks a lot like disease management. So, the need to demonstrate the hard ROI was a lot more acute, but I think it certainly will be the expectation. It's just they were thinking ahead really early on, and it's something I kind of encourage everyone to do as they're launching an employer business.
Okay. I know I want to ask different questions because otherwise we'll be stuck in Livongo. There's a lot to learn.
And you guys have an hour on that next week.
Reframing let's see. Did I ask the question before? Maybe not. How much are employer decisions about health plans affected by expected level of employee turnover and usage of contract labor?
So less the health, well, let's break this out. The kind of carrier that they use, not really much at all. And the amount that they're funding their benefits, like they're going to say, how many employees do we expect to have, or how many employee months do we expect to cover? I think if you are an employer that has a lot of churn in your workforce, you're certainly going to be looking at benefits really differently. And it's going to be more of that kind of in your either attracting customers and saying, this is a great place to work because we have this benefit, or just minimizing in your cost because investments in improving the long-term health of an employee, if they're going to leave after 8 or 9 months, it just doesn't pay off for you as an employer. On the contract labor piece, most employers don't provide benefits to their contractors. So if they have a lot of contract labor, that employer may actually purchase like a much smaller employer than you would expect, because they're only covering a fraction of their employees relative to what you might think based on the number of people that walk around with that badge.
And who in the company decides which benefit to provide? And I mean, who should they reach out to about including their services for the employers? So
depends on the size of the company. Most companies that are self-funded will have a benefits manager, and that person can range from a manager all the way up to a VP, or sometimes they'll have someone who leads total rewards, and that will include both benefits and compensation. Benefits, the vast majority of the time, roll up through HR. The CFO normally has a pretty significant role in choosing benefits because it's such a big line item on the balance sheet. And then the other stakeholder that can get involved in the very large organizations is procurement.
Okay. And next question, how can you determine which employer segment an employer falls in before an initial conversation without proprietary data like plan design, or what question in initial conversation can reveal which segment they would fall in?
Yeah, so there's some kind of rules of thumb on industry, and I think that was another question. Your retail and that kind of world, you're generally in the cost minimizer camp. Your high techs tend to be more towards the right innovators. Your manufacturers kind of depends on how much union they have. So industry can be a good proxy, at least to start. There's a surprising amount that you can find out about benefit plans online through things like Glassdoor. If an employer is advertising their benefits, that probably means they're at least either offering a rich benefit or they're innovating in the space. So that can be a good determinant. You can ask things like, who's your network? What are your what are your priorities and things like that in an initial conversation. You can even ask, how many plans do you have and what type of plans are they? Those are very kind of normal questions to ask a benefits manager in an initial conversation as you're understanding, what they're optimizing for and whether your solution is a fit.
Okay. Next question is, how can you interest an employer early before you give traction? Before you get traction, I guess.
Yeah. So this is where good old marketing is a good place to start. So yeah, you'll see a lot of successful companies will start to put out kind of basically putting their thesis, like what you would have to believe for our solution to be compelling into the market, and kind of sharing that thought leadership. You can start to meet employers through industry events. You can start to kind of get your name out there. One of the other things that's important is, using your VC and using kind of your founder networks to the extent that you can to get some of those relationships with employers who tend to buy solutions earlier, and with channel partners who tend to be on the more innovative side. That can get you attention while you're kind of developing that initial product and help you kind of answer some of those initial questions around, what's the product that's going to fit the market that I'm going after.
Mm-hmm. So it's a good old networking.
Yeah. And I mean, there's a lot to be said for, doing really good B2B marketing and that kind of discipline. I think that the question becomes, how much do you want to spend on that a priori before you've got some leads on revenue through the door?
Right. I think maybe this is the last question. How does the value proposition for employers differ from that of traditional health plans? Yeah. What types of healthcare concerns are specific to employers?
So employers are often thinking more about kind of about productivity, about engagement, about retention. For the value propositions certainly overlap, but an employer is much more focused on the employee experience, and then cost is part and parcel of that. Whereas a health plan is is, they're optimizing for a lot of things, but part of it is getting other employers to sign up for them. So do I have the latest and greatest functionality? Do I have something that's different from my competitors so I can get this employer to sign up? And they're also more on the hook for the total cost of care, and so they're much more likely to optimize for that versus kind of, is this something that's going to cost less this year versus next year.
Mm-hmm. Okay. Do we have one more question? We have one more time to ask one last question. Maybe let's sneak in one. Can you share some perspective on strategy for getting your foot in the door to starting health-related employer conversation? I think you mentioned that through networking. I imagine it would be easiest if they could share claims, but share claims data, and you could give them an estimate for cost saving, quality improvement, but that type of data might be hard to come by.
Yeah, so this is something that you can do. It's easier with a very large employer who has access to their claims data, but certainly something that that businesses will kind of have. You'll want to make sure that you've got a good data science apparatus and someone who actually understands claims, so probably an actuary if you're going to go that route, and just know that that's not something you're going to be able to get the vast majority of the time. So it might be good for getting one of the first couple of customers if you're really kind of going the total cost of care savings route. But it shouldn't be a requirement for selling a case, because that will make it very hard for you, particularly as you're kind of moving down market.
Mm-hmm. Okay, well, that's wrap it up. Well, thank you so much for your time and sharing your insight with all of us.
Thank you, and thank you everyone for the really good questions. This was fun.
Okay, great. Thanks.